What is the new parent choice option? How does it work, and how does it differ from what's currently in place as pertains to state schools' COVID protocol?
Yeah, so, Robert, individual school systems can elect how they determine to make quarantining decisions, and overwhelmingly, systems have used a flow chart from the Louisiana Department of Health over the last year and a half. What I have continued to hear out of some systems and some leaders, and certainly from parents, is just this idea that maybe we are quarantining too many children, and in fact have heard from families who have had to quarantine their kids 3, 4, 5 times for multiple weeks. And so I am not suggesting one particular quarantining protocol over the other. What I'm suggesting is simply that we wanted to give systems an additional protocol that they could consider, which would be a parent choice protocol, which means you identify close contacts, you call the parent, you say, hey, your child may have been exposed to COVID. Do you want them to quarantine? Do you want them to remain in school? And also, here's an opportunity for you if you'd like to have a COVID screening for your kid at no cost. And then, be able to put some of that decision-making and empower the parent to make that decision. So that's where we are. Individual school systems can decide what quarantining procedures they want to use. They can use the one they've been using, or they might want to do this or something different altogether. And I think that'll look a little different across the state.
What was the major motivation in you making this move? Was it medical statistics? Was it talking to people, the boots on the ground in the schools? What exactly was your deciding factor?
Well, a little of all of that. I've heard from educators and system leaders who wanted to do this. Certainly have heard frustration from parents, spoken to members of the medical community, talked to superintendent from another state where this is happening in multiple states around the country. And, I'm not trying to force a system to do one thing or the other. I believe it's their own decision locally on what procedures make sense for them. And I just wanted to clarify that and then simply share another option that they might want to consider.
Dr. Brumley, the health department, though, you're a little bit sideways with them. They are still strongly recommending school districts follow public health guidance and, quote, parents quarantine unvaxxed kids who may have been exposed to the virus. What were your discussions with them like? I mean, did you tell them, hey, I might go this way? And did they say, ooh, we wish you wouldn't?
Yeah, look, we've been strong partners with the Department of Health for a year and a half. Certainly did call them and let them know, what we were considering here, and got their input. Obviously, you saw their quote. They would prefer that systems maintain the present procedure where if a kid's close contact, you call the parent and they go home unless they're vaccinated. And that's fine if that's what a system wants to do. I'm just saying, look, if you prefer a different alternative or an alternative, here's an option that you might want to consider.
Is it your?
So look, I respect the Department of Health. I respect the leaders there and their opinion. I'm just trying to also provide some additional opportunity.
Is it your view, Cade, that the damage we're doing to kids by having them quarantine in and out of school, doing more harm than possibly getting the virus might do to them? Are you close to that opinion?
Yeah, I don't know that I can make that determination, but what I do know is that the virus has taken a toll on all of us, and including kids in terms of our experiences. I am concerned about our youngest learners and their foundational years and multiple absences, multiple quarantines. I'm concerned about high school students who only get one high school experience and continue to be quarantined. And we just, from talking to medical individuals, we're going to have to manage this virus over the next few years as we learn more. And I just feel like, we need to look at alternative ways at times possibly to manage our way through this virus.
In its essence, what you've done is, how do I want to phrase this? You've loosened the loosest but you've kept sort of the strictest in place and told folks around the state, you know your neighborhoods, you know your districts, you know your families, you know your kids, you do what you think is best. Is that sort of where you are?
That's it, Robert. And I mean, I understand, people are pushing back against me on that in certain places, but I just fundamentally believe let local communities, local leaders, local medical experts, families, educators make the decisions that they think are best for their kids. And I think they will. And that's going to look, a little different in different parts of the state. It's going to look different based on the status of the virus. I'm just trying to provide an option for local systems and local communities to make decisions they think are in the best interest of their kids. That's all.
Literally, when you say they're pushing back against me, your response to them in whatever district that would be, okay, well, then you guys do what you think is best, right?
Yeah, that's it. That's why I really don't understand some of that pushback, just because, if a local community doesn't want to do it, if they don't want to do this alternative parent choice option, then don't. Continue to use the LDH guidelines that are already in place. I don't have a problem with that. Like, look, if that's what you want to do it. That's the whole point. Make a decision locally that's best for you.
Will you be keeping track of what the systems are doing, and when do they need to let you know, hey, we're going with your plan, or we're not?
No, they don't have to let us know. This is, a local decision. It has been a local decision. We have a collection of resources available for systems to consider, and I think they will. So we're not trying to overly manage this thing. We're just trying to provide additional options, and I believe that systems and their communities will make decisions in the best interest of their kids.
But Cade, last question: if a child tests positive for COVID, we're not changing that, right?
No, absolutely not. This is a dangerous virus, and we have to manage it. And if a kid is symptomatic, certainly they need to go home. They need to follow the procedures in place. If they test positive, certainly they need to do those same things. We need to make sure that we're watching the spacing in our schools, the cleanliness of our schools. We need to make sure we're following mitigation practices that make sense. I mean, this is this virus is a real deal, and we have to make sure that we are respecting it.